So today I'm going through Appendix W, which I think that I'm going to be listening to this a few times just because it's going to be a great refresher. But this is called lactation terminology, so it's a dictionary basically. So I'm going to go from A to Z in Appendix W. Lactation terminology. A. AAP, American Academy of Pediatrics. AMB, Academy of Breastfeeding Medicine, also acronym for Artificial Baby Milk, Infant Formula. Abscess, a pocket of debris, pus in the body associated with infection, often accompanied by local swelling and inflammation. ACOG, American College of Obstetricians and Gynecologists. Adipocytes, fat cells. Adrenaline, corticosteroid hormone associated with the fight or flight response. AGA, appropriate for gestational age. AIDS, CHIV. ALC, Advanced Lactation Consultant. ALPP, Academy of Lactation Policy and Practice. Albumin, albumin, a form of protein found in the blood. Alternate massage, a method of breast compression used during feeding to increase the flow of milk to the baby. The breast is compressed by hand when the baby pauses in sucking. Alveolar, referring to the alveoli in the breast. Alveoli, small glands in the breast that produce breast milk. Amenorrhea, the absence of menstrual cycle. Anabolism, the process of storing energy in living tissue. ANCC, American Nurses Credentialing Center. Anemia, a condition in which the blood is deficient in red blood cells and hemoglobin or in total volume. Ankylosing, the medical diagnostic term for the congenital condition in which there is a short, thick, or tight flap, lingual frenulum, under the tongue, also referred to as tongue tie. ANLC, Advanced Nurse Lactation Consultant. Anomaly, an unusual condition or abnormality. ANSI, ANSI, American National Standards Institute. AOM, acute otitis media, middle ear infection. APGAR, a 10-point score determined for the newborn baby at birth, reflecting the health of the baby at that time. The name of the score is both the last name of the inventor, Dr. Virginia Apgar, and an acronym for the criteria scored: appearance, pulse, grimace, activity, and respiration. Apnea, temporary cessation of breathing. Apno, APNO, all-purpose nipple ointment, a compounded product containing antifungal, antibiotic, and anti-inflammatory creams. Areola, darkened area around the nipple. Artificial teat, a teat made of synthetic material that is used as part of a feeding bottle or pacifier. Asymmetric breasts, breasts that are not similar in appearance. See also discrepant breasts. Asymmetric latch, optimal attachment to the breast where the baby's lips are not centered in relationship to the areola but rather vertically off-centered with the baby's chin and lower lip closer to the edge of the areola than the baby's upper lip. At-breast supplementer, fine plastic tubing with one end attached to a container holding expressed human milk or formula and the other end extended just past the nipple to deliver supplement to the baby during nursing. Atopy, the genetic tendency to develop allergic conditions such as asthma, eczema, or rhinitis. Averse, tending to avoid. BF, breastfed or breastfeeding. BFHI, the WHO or UNICEF Baby Friendly Hospital Initiative, an international program recognizing hospitals and birth facilities that have implemented the 10 steps to successful breastfeeding. Bifidobacteria, a dominant component of the microbiome of exclusively breastfed babies. Bile, the bitter alkaline product made in the liver and stored in the gallbladder that contains enzymes to assist in fat digestion. Bilirubin, byproduct of the breakdown of hemoglobin portion of red blood cells. Bilirubin encephalopathy, damage to the brain and central nervous system related to hyperbilirubinemia, jaundice, also known as kernicterus. Bleb, a firm small white spot near the nipple pore opening containing accumulated milk solids, also referred to as a milk blister. Block nursing, a pattern of feeding used to deal with an overly abundant milk supply. In block feeding, the parent offers the baby only one breast for 1, 2, or 3 feedings to generate mild local pressure down to slow down milk production. Then the other breast is offered for a block of time. Block milk duct, a condition in which milk from one part of the breast does not flow well and forms a lump of thickened milk that blocks the milk duct. BMI, see body mass index. Body mass index, a measurement of weight status calculated by dividing weight in kilograms by height in meters squared. Bout, an individual feeding. Brachial plexus injury, decreased movement or sensation in the arm caused by injury to the bundle of nerves passing through the shoulder area. This may be caused during birth by pressure to the shoulder area. Bradycardia, slow heart rate. Bradycardia, slow heart rate less than 100 beats per minute in an infant. Breast abscess, area in the breast that feels hot and painful and is full of fluid. It results from unresolved mastitis. Breast compression, a method used during feeding to increase the flow of milk to the baby. The nursing parent gently squeezes the breast when the baby pauses in sucking, also called alternate massage. Breast milk jaundice, jaundice occurring in the breastfed infant after 10 to 14 days of life. The cause of breast milk jaundice is not clearly understood. Brucellosis, bacterial infection from contact with animals carrying Brucella bacteria. Infection causes an undulating fever that spikes in waves. C. Candida, a family of parasitic fungi occurring especially in the mouth, vagina, and intestinal tract. They are usually benign but can become pathogenic and include the causative agent Candida albicans of thrush. Caput succedaneum, swelling of the soft tissues of a newborn's baby scalp that develops as the baby travels through the birth canal. Carbohydrate, chemical names for sugars, starches, and cellulose. Casein, the fraction of milk protein that forms a tough curd. Catabolism, the process of breaking down stored substances to release energy. CCK, cholecystokinin. That's a term that only a nurse or a medical physician would know. Cholecystokinin. CDC, U.S. Department of Health and Human Services, Centers for Disease Control and Prevention. Cephalohematoma, a lump that rises on the head of a newborn within hours of birth due to bleeding beneath the bones of the skull. Chest feeding, a term some lactating, transgender, and non-binary people prefer instead of breastfeeding. Cholecystokinin, CCK. A hormone secreted especially by the intestinal mucosa that regulates the emptying of the gallbladder and secretion of enzymes by the pancreas. chorioamnionitis, inflammation of the fetal membranes due to infection. Circummoral cyanosis, blue or gray coloration of the lips, usually due to inadequate circulation. Clavicle, collarbone, occasionally fractured during the birth process. CLC, certified lactation counselor. Cleft lip, a congenital birth defect causing division of or split in the lip. Cleft palate, a congenital birth defect causing a division or opening in the roof of the mouth. CMV, cytomegalovirus. CNS, central nervous system. Collaborative feeding, phase of breastfeeding following self-attached feeding in which the nursing dyad are learning to manage feeding together. Colostrum, the first milk produced in the breast by the 7th month of pregnancy. Colostrum is thick, sticky, and clear to yellowish in color. Is high in protein and vitamin A and causes a laxative effect, thus helping the baby to pass meconium. Immunoglobulins, mostly IgA, in colostrum provide an anti-infective protection to the baby. Complementary feeding, providing foods other than human milk and infant formula to an infant between 6 and 23 months, a period when milk feeds alone can no longer meet the infant's nutritional requirements. Congenital, a condition that is present at birth. Contraindication, a condition or factor that makes something inadvisable. Cooper's ligaments, the triangular-shaped ligaments underlying the breast. Corliss type, a classification system for ankylosing or tongue tie. Cradle hold, breastfeeding position in which the baby is held on the parent's lap with his or her head resting on the parent's forearm directly in front of the breast, also called the Madonna hold. Craniofacial, involving the head and skull. Crib death, the unexpected and sudden death of a seemingly normal and healthy infant that occurs during sleep with no physical evidence of disease, also called sudden infant death syndrome, SIDS. Cyanosis, blue or gray coloration of the skin, usually due to inadequate circulation or low oxygen levels in the blood. Cytomegalovirus, a virus of the herpes family that is relatively harmless in adults but can cause severe systemic infection in infants, particularly those born prematurely. One second. Okay, D. Dancer hand position, a technique that provides support to the breast and the infant's chin to stabilize the infant's jaw and maintain good attachment throughout a feeding. Often useful when breastfeeding infants are not able to hold or maintain seal at the breast due to prematurity or neuromuscular challenges. Dehydration, a condition in which the infant is not receiving adequate fluids or is unable to maintain adequate hydration for another metabolic reason. In addition to the symptoms of actual dehydration, vomiting, diarrhea, and nausea could be adding to or causing the dehydration. The problem can become grave for the young infant. Symptoms include dry or sticky mouth, low or no urine output, concentrated urine that appears dark yellow, non-production of tears, sunken eyes, markedly sunken fontanelles in the infant, lethargy or coma with severe dehydration. Diabetes mellitus, DM, a group of diseases in which the body has difficulty managing stable blood sugar. Disaccharide, a class of carbohydrates made up of two monosaccharides, e.g. lactose. Discordant twins, twin pairs with a marked difference in size at birth. Discrepant breasts, a condition in which a woman's breasts are markedly different in size and or shape. This is associated with potential milk supply problems, also called asymmetric breasts. Diuresis, increased production of urine, shedding excess body fluids. Diurnal, pertaining to a daily cycle, often used in referring to things that change over the course of the day, e.g., hormone levels. DOL, delayed onset of lactation. Domperidone, a drug used to treat digestive difficulties that has a side effect of increasing prolactin levels. This drug is not approved for use in the United States. Doula, a person trained to support individuals during the birthing and perinatal period, colloquially known as mothering the mother. Down syndrome, DS, a congenital condition characterized by moderate to severe mental retardation, also called trisomy 21. Trisomy 21. DRI, dietary reference intakes used to assess an individual's nutrient intake. DS, Down syndrome. Dyad, a group of two. In lactation terms, usually refers to the nursing parent and the baby. Duarte galactosemia, a variant of galactosemia with generally milder complications. EBF, exclusively breastfed or exclusively breastfeeding. C, exclusively breastfeeding. EBM, expressed breast milk. EBMF, C, exclusive breast milk feeding. Early term infant, an infant born between 37 and 0 out of 7 weeks and 38 and 6 out of 7 weeks gestation. Early term infant, an infant born between 37 and 0 weeks and 38 and 6/7 weeks gestation. Eczema, a non-contagious inflammation of the skin characterized chiefly by redness, itching, and the outbreak of lesions that may become encrusted and scaly. Edema, swelling from excess accumulation of fluids in the cells or tissues of the body. Efficacy, the capacity to produce intended outcomes, to achieve goals, etc. ELBW, see extremely low birth weight infant. Electrolytes, minerals that are involved in maintaining healthy fluid balance in the body, such as sodium and potassium. Engorgement, swelling in the breast that blocks milk flow, caused by inadequate or infrequent milk removal. The breast will be hot and painful and will look tight and shiny. With severe engorgement, milk production may stop. Enteromammary, a route of transmission for GI bacteria from the gut to the mammary tissue and thus into the milk. Etiology, the causes of a disease or condition. Everted nipple, a nipple that turns outward when stimulated. Exclusive breastfeeding, EBF, the feeding of human milk as an infant's only food source. The World Health Organization 2008 indicates infants included in this category may also be receiving oral rehydration solution, vitamins and minerals, and or other oral medications, but may not receive any other foods or fluids. Exclusive breast milk feeding, EBMF, a term used by the Joint Commission of 2015 to describe those infants who are receiving only human milk, whether at the breast or by feeding or other feeding method. Extremely low birth weight infant, ELBW, an infant with a birth weight less than 1,000 grams or 2.2 pounds. F, failure to thrive, FTT, a condition in which an infant's or a child's growth is inadequate and requires medical evaluation. Feeding cues, infant behaviors that indicate an interest in eating, including rapid eye movement, movement of hands near the face, rooting and seeking emotions, and other behaviors. FF, formula fed, flat nipple, a nipple that everts in response to stimulation but is otherwise not projected. Follicle, a small cavity or sac. Fontanelles, the opening between skull plates in an infant. These are also referred to as soft spots. Foremilk, in research studies, the milk that is expressed at the beginning of a collection cycle. Frenulum, the membrane that supports or restricts the movement of a body part. For example, The lingual frenulum supports the tongue. The labial frenulum supports the lips. FTT, see failure to thrive. Full term, an infant born between 39 and 0 and 7 weeks through 40 and 6 and 7 weeks gestation. G. G6PD, see glucose 6 phosphate dehydrogenase deficiency. Galactocell, a milk filled cyst in the breast, most likely caused by an obstructed duct. Galactagogue, substances that are believed to increase milk production. Galactopescis. Galactopescis, the development of mature milk in the mammary gland and the maintenance thereof. Galactose, a simple sugar that is a portion of galactose, the carbohydrate present in milk. Galactosemia, congenital metabolic disorder causing inability of the body to use the simple sugar galactose, causing accumulation of galactose 1 phosphate in the body, which results in damage to the liver, central nervous system, and other body systems with permanent, even fatal outcomes. Gape, a wide opening of the mouth, ideally 140 degrees to 160 degrees. Gastrin, a hormone secreted by the stomach lining that includes secretion of gastric juices. Gastrointestinal, having to do with the stomach and intestinal tract. GDM, see gestational diabetes mellitus. Genitourinary, GU, referring to the genitals and urinary organs. Gestational, regarding the period from conception to birth. Gestational diabetes mellitus, GDM, a form of diabetes that occurs in pregnancy. GI, see gastrointestinal. Gilbert syndrome, a hereditary tendency toward hypobilirubinemia caused by reduced activity of the enzyme that assists in breaking down bilirubin to a form that can be easily excreted. Typically a benign condition. Glucose 6 phosphate dehydrogenase deficiency, G6PD, a hereditary metabolic enzyme deficiency that leads to mild destruction of red blood cells and jaundice when the individual is ill or exposed to substances ranging from fava beans to sulfur drugs and beyond. Goldsmith signs, the association of a baby's persistent refusal of one breast with possible breast cancer. GU, genitourinary. H. HCP, healthcare provider, also Healthy Children's Project Inc. Hematoma, a blood-filled swelling resulting from a broken blood vessel. Hemolysis, the breakdown of red blood cells. HGH, human growth hormone. Higher order multiples, HOM, pregnancies with 3 or more infants, triplets, quadruplets, etc. Hind milk. In research studies, the milk that is expressed at the end of a collection cycle. HIV, see human immunodeficiency virus. HM, human milk. HMF, human milk fortifier. HMO, human milk oligosaccharide. HOM, see higher order multiples. HTLV, human T-cell lymphotrophic virus. Actually, just to go back, HMO can mean multiple things in the medical field, but in this context, it means human milk oligosaccharide, just in case you're thinking of the health plan. Human immunodeficiency virus, or HIV, a group of retroviruses, especially HIV-1, that infect and destroy helper T cells of the immune system, causing the marked reduction in their numbers that is diagnostic of acquired immune deficiency syndrome, AIDS, also called AIDS virus. Human milk oligosaccharide, HMO. Carbohydrate components of human milk that serve to promote bifidobacterial growth. Hydrolase formula, infant formula in which proteins are chemically broken down through hydrolysis into smaller chains of amino acids. These formulas are designed to trigger fewer allergic reactions, but evidence is lacking. Hyperbilirubinemia, high levels of bilirubin in the blood. See also jaundice. Hyperinsulinemia, insulinemia, the presence of excess insulin in the blood. Hypernatremia, abnormally high concentration of sodium in the blood. Hyperthyroidism, increased activity of the thyroid gland, leading to excess production of thyroid hormone. Hypoglycemia, low blood sugar. Hypoplastic, underdevelopment or incomplete development. Hypothermia, low body temperature. Hypothyroidism, decreased activity of the thyroid gland, leading to decreased production of thyroid hormone. Hypotonia, low muscle tone. IBCLC, International Board Certified Lactation Consultant. IBLCE, International Board of Lactation Consultant Examiners. IDDM, Insulin Dependent Diabetes Mellitus. See Type 1 Diabetes Mellitus. T1DM. IFPS, Infant Feeding Practices Survey. IGF, see Insulin-like Growth Factor. Immunoglobulin, group of proteins that provide immunity, including IgA, causes passive systemic immune protection, blocks the adhesion of microbial pathogens onto the intestinal wall, and forms antibodies against bacteria and viruses. IgD forms antibodies against bacteria. IgE combines with antigens in the gut lumen and releases chemical mediators that cause increased vascular permeability. IgG can activate complements and acts against bacteria and viruses. IgM forms antibodies against bacteria and viruses, retains activity after traversing the intestinal canal. Induced lactation, process of establishing a milk supply in an individual who has not given birth. Inflammation, a localized reaction of tissue to the presence of items perceived to be foreign or other irritation, injury, or infection characterized by pain, redness, and swelling. Innervation, distribution of nerves to or in an area of the body. Insulin, a hormone produced by the pancreas that regulates blood glucose levels. Insulin-like growth factor, IGF, a protein similar in function to insulin that plays a role in determining growth. Interbout interval, the period of time between breastfeedings or milk expressions. Intercostal nerves, nerves in the thoracic or chest area that innervate the breast, among other areas. Intrapartum, the period around childbirth. Inverse association, a relationship in which when one thing increases, the other decreases. Inverted nipple, a nipple that turns inward when stimulated. ISO, International Standards Organization. IUGR, intrauterine growth restriction. J, jaundice, condition that results when red blood cells break down faster than the liver can handle, causing a yellow color of the skin. In a newborn, normal physiologic jaundice is caused by the immaturity of the liver. K, kangaroo mother care, KMC, a special form of prolonged skin-to-skin contact used in the care of small and premature infants. Kernicterus, damage to the brain and central nervous system related to hyperbilirubinemia, jaundice, also known as bilirubin encephalopathy. KMC, see kangaroo mother care. L, lactase, an enzyme produced in the intestines that assists in digesting lactose into glucose and galactose. Lactation, the process of making milk, also the stage of making mature milk, also known as lactogenesis 3 or galactopesis. Lactiferous duct, see milk duct. Lactocyte, a milk-making cell. Lactoferrin, an iron-binding protein found in human milk, thought to inhibit the growth of microorganisms in the infant's gut, as well as playing other protective roles. Lactogenesis, stages of development of the milk production process. Lactose, a disaccharide sugar found only in mammalian milk. LAT, Health Education Associates, Lactation Assessment Tool. Oh, LAT, I'm sorry, LAT, Health Education Associates Lactation Assessment Tool. Late preterm infant, LPTI, an infant born between 34 and 0 and 7 and 36 and 6 and 7th weeks. Late term infant, an infant born between 41 and 0 and 7th weeks through 41 and 6 and 7th weeks. LBW, low birth weight. Infant weighs less than 2,500 grams or 5 pounds and 8 ounces. LCP, lactation care provider. LCPUFA, long chain polyunsaturated fatty acid. Long chain polyunsaturated fatty acid. LND, labor and delivery. Letdown reflex, the spontaneous ejection of milk from the breast. See also milk ejection reflex. LGA, large for gestational age. Lochia, blood, mucus, and uterine tissue discharge via the vagina for 4 to 6 weeks after birth. There are 3 stages of lochia. The first discharge, lasting between 1 and 4 days after birth, is the red lochia ruba, or cruenta, which is mostly blood. It typically becomes less and less and finally can be described as spotting. The second stage, which lasts until about the 10th day after birth, is lochia serosa. It is thinner and brownish or pink in color. The third stage is the whitish or light yellow lochia alba, or purulenta, which typically starts in the 2nd week and can last up to 6 weeks after the birth. When lochia serosa continues for weeks or lochia rubra begins again after stopping, it is a serious concern and should be reported urgently to the healthcare provider. Low birth weight infant, LBW. Infant weighing less than 2,500 grams, less than 5 pounds 8 ounces at birth. LPTI, see late preterm infant. Lumen, the cavity or channel within an organ, such as the open space within the milk ducts. M, malaise, a sense of weakness or illness. Malnutrition, a state in which the baby is either overfed, underfed, or unable to correctly utilize the food he or she is receiving. Mammary, pertaining to the milk-secreting organs of mammals. Mastitis, inflammation in the breast causing localized tenderness, redness, and heat. May result in fever, feeling tired, achy, or nauseous, or headache. Mastitis may or may not be an infective process. Meconium, first stool of a newborn, varying from greenish-black to light brown with a tarry consistency. Metabolic syndrome, a group of medical conditions that, when occurring together, increase risk for diabetes and heart disease. Conditions included in the syndrome are high BMI, high blood pressure, abdominal obesity, high triglyceride levels, low levels of HDL cholesterol, and high fasting blood sugars. Methicillin-resistant Staphylococcus aureus, MRSA, a bacterial infection that is resistant to many antibiotics. Microbiome, the community of non-human cells such as bacteria, fungi, viruses, and protozoans that live within and on the human body. Microbiota, the non-human cells that live within and on the human body. Microcephaly, abnormal smallness of the head. Milk duct, narrow tube structure that carries milk to the nipple. Milk ejection reflex, reflex initiated by the production of the hormone oxytocin that causes the contraction of the myoepithelial cells, ejecting milk from the breast. Mitigate, to alleviate or make milder. Montgomery glands, small tubercles in the areola of the breast that contain both sebaceous and mammary lobes. These glands become more marked in pregnancy and secrete a fluid that lubricates the nipple area. Morbidity, the incidence of disease, mortality, death. Moral reflex, a response present in the normal infant from the third trimester through the fourth or fifth month after birth. When pulled up from a lying position and then released, the infant will spread its arms and then fold them back to the body, usually crying. MRSA, see methicillin-resistant Staphylococcus aureus, Staphylococcus aureus. Mucin, compounds made up of protein with attached carbohydrates that are part of the structure of mucosa, the lining of body cavities that produces mucus, a viscous secretion containing mucin. Mucus, the sliming substance secreted by the mucosa for protection and lubrication. Multipara, a woman who has given birth to multiple babies. Myocardial infarction, heart attack. Myoepithelial cells, smooth muscle cells that encircle the alveoli and ducts of the breast. Contraction of these cells causes the outward flow of milk. I highlighted that one. Maybe it was on an exam. Anyway, N, narcotic, a drug with sleep-inducing effects. See opioids. NAS, see neonatal abstinence syndrome. Nasopharynx, the part of the throat directly behind the mouth and the nasal cavity and above the esophagus and larynx, voice box. NCHS, CDC's National Center for Health Statistics. NEC, necrotizing enterocolitis. Necrotizing enterocolitis, NEC, a condition that typically occurs in premature or sick infants when the lining of the wall of the intestine dies. The cause of NEC is not known. Neonatal abstinence syndrome, NAS, a group of problems often experienced by infants who have been exposed to addictive substances used by their birth parent during pregnancy, especially opiates. Withdrawal symptoms for the baby include excessive crying, sleep disturbances, irritability, vomiting, diarrhea, feeding difficulties, and trembling, among others. Neonate, newborn infant, newborn. An infant younger than 28 days of life, or less than 6 weeks of age, according to some sources. NIDDM, non-insulin dependent diabetes mellitus. See type 2 diabetes mellitus. 9 stages. The 9 instinctive behavioral stages newborns, babies go through in the first hours after birth. I think that's called Whitcomb's 9 stages. Wickstrom's 9 stages. Non-nutritive sucking that causes little or no milk secretion, associated with 8 or more sucks per swallow. Breast fullness normal fullness, breast fullness that occurs when the milk is coming in. Extra blood and lymph are brought to the breast. The breast may feel warm, full, and heavy. NSAIDs, NSAIDs, non-steroidal anti-inflammatory drugs, e.g. ibuprofen. Nurser, the person who is nursing the baby at the breast or chest. Nursling, a baby or child who feeds at the breast or chest. Nursing, feeding at the breast or chest. Nutritive sucking that causes milk flow, typically thought of as 1 or 2 sucks per swallow. I'm now on O. I'm just looking through to see. I think I have like 9 pages left. Obturator, a dental device similar to a retainer that may be used when feeding infants with cleft palate. Opioids, medications that contain one contain or are similar to opium, used to decrease pain and increase relaxation. These drugs can be highly addictive. Osmotic forces created by diffusion of water from an area of greater to one or of lesser concentration, creating an equal distribution of water in both areas. Otitis media, middle ear infection, oversupply, a condition of excess milk production. Oxytocin, hormone that contracts the cells around the alveoli and sends milk down the ducts and out the nipple pores, causing milk ejection, also known as letdown. P, paracellular movement between cells. Patent, refers to structures such as milk ducts that are connected or open rather than closed. PCOS, see polycystic ovarian syndrome. Perinatal, around the time of birth, both pre and postpartum. Peripartum, around the time of birth, both pre and postpartum. pH, a measure of acidity or alkalinity of a substance expressed on a scale of 0 to 14, where 0 is the most acidic, 7 is neutral, and 14 is the most alkaline, basic. Phenylalanine, an essential amino acid. PKU, phenylketonuria, an inherited disease resulting in the inability to digest the amino acid phenylalanine. People with this diagnosis must avoid foods containing phenylalanine due to the risk of brain damage. Phenylketonuria placenta, the organ that forms in the uterus to provide an interface between maternal and fetal circulation. The placenta provides nourishment to the fetus and transfers fetal waste to the mother's circulation. PIBS, P-I-B-B-S, Preterm Infant Breastfeeding Behavior Scale. Pierre-Robin sequence, a group of malformations of the face that are present from birth. Effects of the sequence can include small lower jaw, clefts of the palate, and problems with tongue coordination and breathing. PIF, powdered infant formula, also used for prolactin inhibitory factor. PIFI, P-I-F-I, prolactin inhibitory factor inhibitor. Pitocin, a synthetic form of oxytocin administered to stimulate uterine contractions. Pituitary infarct, death of an area of tissue in the pituitary gland which is found in the brain. PKU, see phenylketonuria placenta. PMS, premenstrual syndrome, progestin-only contraceptives. Polycystic ovarian syndrome, PCOS, a hormonal condition among women that is a major cause of infertility. Postterm infant, an infant born at 42 and 07 weeks and beyond. Postprandial, referring to the period after a meal. Postpartum, referring to the time period after giving birth. Postpartum adjustment disorder, PPAD, mood changes occurring to a woman in the first year after giving birth. Postpartum depression, PPD, depression occurring in the first year postpartum. Postpartum post-traumatic stress disorder, PTSD, a mental health condition caused by a traumatic event. In this context, one experienced at the time of giving birth. Symptoms can include extreme anxiety, flashbacks, and panic, among others. PPAD, see postpartum adjustment disorder. PPD, see postpartum depression. PTSD, see postpartum post-traumatic stress disorder. Predominant breastfeeding, the feeding of both human milk as well as border-based drinks, ritual foods such as teas, oral rehydration solution, vitamins, minerals, and oral medications to the baby. Premature infant, a baby born before 37 weeks gestation. Premenstrual syndrome, a cluster of symptoms ranging from headaches, mood changes, and fluid retention occurring in the days before menstruation. Preterm infant, a baby born before 37 weeks gestation. Primipara, PREMIP, a woman who is giving birth for the first time. Progesterone, a hormone produced by the placenta during pregnancy. Progestin, a synthetic form of progesterone used in many birth control methods. Prolactin, a hormone that stimulates the production of milk. Prolactin inhibitory factor, PIF, a substance in the bloodstream that suppresses the action of prolactin. Prolactin inhibitory factor inhibitor, PIFI, a substance in the bloodstream that suppresses the action of prolactin inhibitory factor, thus allowing prolactin to influence the cells of the mammary gland. PUFA, polyunsaturated fatty acids. Q. We'll take a break. QI, see quality improvement. Quality improvement, systematic actions taken by healthcare organizations to track and improve patient outcomes. Quartile, a term used in statistics to refer to distribution of results into four groups that occur with equal frequency. Questing, actions taken to search with purpose, e.g. the infant searching for the nipple. Randomized control trial, RCT, the gold standard for medical research in which research subjects are randomly assigned to treatment groups and compared with a control group that receives a placebo treatment. Raynaud's syndrome, a medical condition associated with vasoconstriction and reduced blood flow to an extremity of the body in response to cold stress. RCT, see randomized control trial. Redundant. In the context of the protection offered by human milk refers to many overlapping or backup methods for protection. Relactation, process of reestablishing adequate milk production in an individual who has a greatly reduced milk production or who has stopped breastfeeding. REM, rapid eye movement, a light sleep state. Retained placental fragments, portions of the placenta left in the uterus after the cervix has closed. In this situation, sometimes the fragments continue to secrete enough progesterone to affect lactogenesis stage 2, secretory activation, and lactogenesis stage 3, lactation. This condition may be evidenced by an abnormal pattern of lochia. Because of the possibility of hemorrhage and or infection, urgent assessment is needed as soon as retained placental fragments are suspected. Reverse cycle nursing, description of a feeding pattern in which the nursing diet sleeps in close proximity and nursed during the night. The parent then goes to work in the morning and the baby sleeps most of the day. ROL, review of the literature. Rooming in, a bonding approach in which the dyads share the same hospital room beginning as soon as possible after birth. Rooting reflex, natural instinct of the newborn to turn his or her head towards the nipple and open his or her mouth when the mouth area is gently stroked with the nipple. S, skin to skin. Sclera, the white layer of the eyeball. Sebaceous, related to the production of skin oil. Sebum, secondhand smoke. Tobacco smoke that is breathed from being in the presence of others who are smoking. Secretory activation, the second stage of milk making, which occurs after delivery of the placenta, also called lactogenesis 2. Secretory differentiation, the first stage of milk making, which occurs during pregnancy, also known as lactogenesis 1. Referring to the baby's ability to find, attach to, and suckle from the breast. Self-attached, referring to the baby's ability to find, attach to, and suckle from the breast during the first weeks postpartum. Sentinel case, any unanticipated event in a healthcare setting resulting in serious injury or unintended outcomes. Sepsis, severe infection in the bloodstream. Serology, blood work. SF, soy formula or soy fed. SGA, small for gestational age. Sheehan syndrome, damage to the pituitary gland caused by postpartum hemorrhage, resulting in an inability to produce pituitary hormones, including prolactin. SIDS, sudden infant death syndrome. See crib death. Skin to skin, the practice of holding the infant so that his or her bare chest is against that of the parent. The baby is held under the parent's clothing and covered as needed for warmth. This technique has been demonstrated to help the baby regulate heart rate, respiratory rate, and body temperature, and facilitates early breastfeeding, abbreviated as S2S and STS. SNS, Supplementary Nursing System, a type of at-breast supplementer. Somatostatin, a hormone that, with multiple effects in this context, inhibits the secretion of gastric hormones, thereby slowing digestion. SSC, skin-to-skin care or contact. Stasis, a state in which bodily fluids stop flowing. Stridor, a high-pitched wheezing sound. STS, skin-to-skin. Stunting, impaired growth and development in childhood associated with malnutrition and or infection. Determined by height for age percentile. Submucosal cleft, an opening in the bone above the roof of the palate that is covered with normal skin lining and is therefore more difficult to identify. Sucking, drawing into the mouth by forming a partial vacuum with the lips and tongue. Supplementary feeding, the giving of food other than breast milk to an infant to replace breast milk calories. Subsymptothermal, a method of fertility awareness that relies on tracking calendar rhythm, basal body temperature, and other techniques such as cervical mucus. T1DM, see type 1 diabetes mellitus. Tandem nursing, nursing two or more children not of the same pregnancy. For example, a newborn and a toddler. 10 Steps to Successful Breastfeeding, guidelines developed by UNICEF and the World Health Organization that promote, protect, and support breastfeeding in facilities that provide maternity services and care for newborn infants. See also BFHI. Term infant, a baby born at or after 37 weeks gestation. Theca lutein cyst, benign growths in the ovaries. Third hand smoke, exposure to residual nicotine and other chemicals from contact with surfaces present where cigarettes are smoked, e.g. car seat, parental clothing, upholstery. Third spacing refers to the presence of body fluids in spaces outside their normal compartment, e.g. milk leaking between milk cells and into the breast during engorgement. Thoracic refers to the chest area. Thrust infection caused by the least Candida albicans that the baby may contract through the birth canal. It may produce white patches and ulcers in the baby's mouth. The baby may then transmit the oral infection to the breasts. TJC, the Joint Commission, a certifying body for healthcare organizations. Tongue tie, medical diagnosis. Restriction of the tongue caused by a short or tight membrane of skin, frenulum, under the tongue. Torticollis, swelling of the muscles of the neck causing restricted ability to move the head. Transcellular, movement across the cell membrane. Transgender, individuals whose gender identity is different from the gender they were thought to be at birth. Tubercles of Montgomery, see Montgomery glands. Type 1 diabetes mellitus, T1DM, a chronic illness in which the pancreas produces little or no insulin, resulting in excess glucose levels in the blood, also referred to as insulin-dependent and juvenile onset diabetes. This form of diabetes is typically controlled with administration of insulin as well as diet, exercise, and possibly other medications. Type 2 diabetes mellitus, a chronic condition in which insulin resistance and or inadequate insulin production causes excess glucose levels in the bloodstream, previously referred to as non-insulin dependent or adult onset diabetes. Previously referred to as non-insulin dependent or adult onset diabetes, this form of diabetes is often controlled with diet, exercise, and oral medications. UCB, unconjugated bilirubin, a form that accumulates in the body. UNICEF, United Nations Children's Fund. V, vascular, pertaining to the blood vessels. Vasospasm, constriction of the blood vessels by tightening of the muscles around them, typically causing reduced blood flow through that area. Vector, a carrier or route of infection. Very low birth weight infant, VLBW, infant weighing less than 1,500 grams or 3.3 pounds at birth. VLBW, see very low birth weight infant. W. Water intoxication, a potentially fatal consequence of electrolyte imbalance caused by overconsumption of water. Whey, a protein fraction of milk that is prominent in human milk. WHO, World Health Organization. WIC, USDA, and state-funded special supplemental nutrition program for women, infants, and children. WNL, within normal limits. And that is the end of Appendix W, terms. It's going to be very useful terminology. So I hope that was helpful. That was the end of Appendix W. And then I'll be moving on to the rest. Thank you.